Welcome to The Explainer. Today, we're diving into a really big idea, one that's been around for over 100 years. How do we unlock human potential? And we're going to do that by taking a look at an organization called Devereux. They're one of the country's largest nonprofits in behavioral health care. And the work they do is, well, it's absolutely critical.
But to really get why this work is so important, we have to start by facing a pretty tough reality. It's this crisis of connection that's hitting communities all across the country.
Okay, look at this number. Nearly 50,000. The CDC says that's how many Americans we lost to suicide in just 1 year. To put that into perspective for you, that's a life lost every 11 minutes. Think about that. It's not just a number on a screen, right? It's a massive public health crisis, and it's screaming out that there's a huge need for better connection and support.
So you might be asking, where do we even start with a problem that big? Well, this quote right here, it gives us a clue. It all begins with recognizing the warning signs, things like hopelessness or seeing someone pull away from everything. Once you can see those signs, that's when you can actually step in and offer support before it's too late.
So, when we're facing a challenge this big, who are the folks on the front lines, really doing the work? Well, that brings us right to Devereux Advanced Behavioral Health.
So, for more than 100 years, Devereaux has been a major player in behavioral health. And what's really important here is that they're a nonprofit. That means their mission is all about service, not about making money. It lets them focus completely on leading the way and providing top-notch care for people who are dealing with some really complex behavioral health challenges.
And this right here, this is their North Star. It's pretty simple, really. It's about looking at every single person, no matter what their emotional, behavioral, or cognitive differences might be, and focusing on one thing and one thing only, nurturing their potential, and doing it in a place that feels safe and genuinely caring.
Okay, so that's the mission. But what does it actually look like in the real world? Let's take a look at who exactly Devereux is helping.
Wow. The first thing that jumps out at you here is just how wide-ranging their work is. I mean, we're not just talking about support for folks with autism or developmental disabilities. They're also working inside foster care systems, in specialty mental health, and, get this, right inside our schools. So you've got this incredibly diverse group of people they're supporting. The big question is, how do they do it? How do they deliver that kind of specialized care all over the country?
It's all about their approach, which is kind of like this incredible self-improving cycle. See, it all starts with direct hands-on care. But they don't just stop there. Nope. They take what they learn from that and bring it into schools to help with prevention. Then they use those insights to train other professionals, which lifts up the entire field. And all of that gets fed back into research to make their programs even better. Each piece makes the other pieces stronger. It's really smart.
But, a system like that is only as good as the people running it. And at the end of the day, this whole mission is powered by thousands of incredibly dedicated professionals. The people who actually bring it to life, day in and day out.
Remember that direct care step we just talked about? Well, it becomes real through people like Deanna Renz, a nurse practitioner down in Georgia. Her whole focus is on serving and inspiring others every day. That really shows you the kind of compassion that's at the very heart of this organization.
And that compassion, it's there from the very first moment someone connects with them. You've got people like Andrea Bell, an admissions coordinator in Texas. Her job is to make sure that from day one, every single person's journey starts with dignity, and with that feeling of being genuinely heard and valued.
And it's not just about one-on-one care either. The impact ripples out to change entire systems. You have leaders like Dr. Colleen Katzenmoyer who are focused on that big picture. They're using all that research and training to make the support systems for families, for schools, for whole communities stronger. We're talking about making real, lasting change.
So when you put it all together, the direct care, the programs in schools, the research, it's all driving towards one single ultimate goal. And that brings us right back to where we started.
This sentence says it all, really. The whole point isn't about fixing people or just, managing symptoms. The real goal is to fundamentally change lives. It's about creating an environment of growth and connection and belonging, the kind of environment that allows every single person's true potential to finally shine through.
And you know what's great? This kind of work shows that building connections and nurturing potential isn't just a job for the professionals. There's a role for all of us. Maybe it's just learning more about behavioral health. Maybe it's thinking about a career in this field. Or maybe it's supporting the mission with a donation. The point is, every little bit helps.
So, we're going to leave you with this one final thought to chew on. It's a question that's bigger than just one organization.
It's really about all of us and how we support each other in our own lives, in our families, at our jobs, and in our communities.